So let's now demonstrate how this very same patient that the resident has just presented to you would be, how SNAPPS would work in that setting. So after the resident told you about this 25-year-old woman with abdominal pain, you would say, please summarize briefly for me the history that you just obtained. And they might say, well, it's a 25-year-old sexually active woman with acute right lower abdominal pain of 1 day's duration. There's been no prior history of bowel or bladder disease or surgeries. There's no prior pregnancies. She's sexually active, but with unreliable contraception. You would then say, now can you narrow the differential to 2 or 3 relevant possibilities for this patient? And the resident might say, well, I think irritable bowel syndrome would be the most likely, but I suppose you have to consider appendicitis and maybe something like an ectopic pregnancy. You would ask them then to analyze their differential. Why do you say irritable bowel? I say irritable bowel syndrome because I know young women, especially fast food workers, might be prone to that disorder, so it would seem to be the most common. I don't hear that the patient has fever or anorexia to suggest appendicitis, and I really don't know that much about ectopic pregnancy to know if that's a real consideration. That would then allow the resident to probe the preceptor and to ask you, when should I suspect ectopic pregnancy? Where you could teach that in young sexually active women with acute abdominal and pelvic pain complaints, especially if there's some accompanying vaginal bleeding, ectopic pregnancy is a consideration and a serum HCG test must be checked. You'd then go back to the resident to say, how should we plan our next steps in management of this patient? And the resident might say, well, I suppose you get a CBC and a serum HCG test and do a careful pelvic exam and then see where those things lead you. And you would then go on to emphasize that if there is still a concern, especially with a positive pregnancy test for an ectopic pregnancy, that you would need to get a transvaginal ultrasound to further evaluate the situation. And then the last step, selecting a case-related issue for self-directed learning, you would probably tell the resident, why don't you read up on the diagnosis and treatment of ectopic pregnancies, including kind of pharmacologic versus surgical management of an ectopic pregnancy.